Mm. Hi, this is Dr. Cordy. We have an Aerolase laser in our practice, which is very, very effective for photo skin rejuvenation, like laser facials. It's also very effective for hair removal. And one of the reasons we have it in our practice is because we have a lot of hormone imbalance patients who have some level of hair growth on their face and they want to get rid of that, or body hair growth, and they don't like that either, and they want to get rid of that permanently. The Aerolase is a great answer for that because it does permanently remove hair. It does it really, really effectively. And in addition to that, in our practice, we also know how to handle and heal the underlying cause of the potential for more hair growth, so that hopefully we can really repair that mechanism so that it stops pushing more hair follicles to make those darker hairs grow on the face and on the chest and on the belly. And so we slow that down, but also handle the entire condition that is creating the hormone dysfunction in the first place, which is of course really, really important. So the laser has been a really fun addition to our practice because we've been able to handle in sort of a more short-term way or a very quick way the hair growth, in addition to the functional medicine approach that we have to really correcting the hormone dysfunction that lies underneath the reason why the hair is growing in the first place. Hair growth and hirsutism, which it's referred to as, is the abnormal hair growth on the face, usually on the chin or like along the jaw line especially. But I see it all over the face. It can even be up on the forehead sometimes, and down on the neck a little bit, and then definitely in the midline sort of the breastbone or the sternum, and then really kind of a little bit above but more below the belly button down to the pubic bone. And we'll see that abnormal hair growth occur in even like very light haired or blonde haired women will have very, very dark hairs that are very testosterone or androgen driven. They'll also generally have acne problems around those hairs. So it's nice to be able to treat the hair directly with the laser, because by destroying the hair follicle so it no longer grows that dark hair that's unwanted, it also helps the additional sebum or excess oil production that helps cause the acne, while we again take care of the underlying hormone imbalances. So it's a nice way to immediately help some of the current hair growth, and then we cycle through treating that. And then longer term, we really need to handle the underlying hormone condition, which is a much bigger answer and a much bigger project than just getting treated with a laser 4 to 6 times over the course of like 4 to 6 months. But it's necessary if we want to stop the future production of more hair follicles. And so, as much as the Aerolase laser has been really effective and a really safe way to handle patients who have hair growth that's abnormal on their face that they do not like from PCOS, and we can handle it in all skin types and colors, from a Fitzpatrick skin type of 1 all the way through a Fitzpatrick skin type of 6, anyone from white skin to brown skin to black skin. It's safe for all of those, and it's safe for all of the abnormalities that come with that hair growth, like the darker spots that happen when you have a hair and then it damages the skin or it gets shaved off and you get a little scar under that. It helps all of the conditions of the skin that come with the abnormal hair growth, and the scarring or the scabbing or the infections that come along with the hair growth and the acne. And so we can do all of that with the laser treatment. And then over time, we can also handle the underlying condition of the hormone dysfunction. And so eventually, you won't need more laser treatments because your body isn't stimulating more abnormal hair growth, because we've figured out where the problem is coming from, what kind of PCOS you have. And we've also figured out how to manage that through foundational nutrition, diet, lifestyle, and behavior changes, and really just support your system overall. So I hope this helps. That's really the way we handle abnormal hair growth in our practice, is really 2 ways, like the immediate let's get rid of the hair way, but also the long term let's figure out why it's growing in the first place and then help it not grow more in the future. I hope this helps, and have a good rest of your day.